Dr. Michael Carducci, one of the co-authors of the E3805 charted study, discusses the addition of docetaxel to initial hormonal therapy in men with metastatic prostate cancer during the ASCO annual meeting in Chicago. The results showed that the combination of docetaxel and hormonal therapy leads to a better overall survival when compared to androgen deprivation therapy alone. What treatment strategy did you study, and how many patients were involved?
Great. So this was a cooperative group study in the U.S. that was really looking at the answer at a time when chemotherapy was just finally approved and showed an overall survival advantage in men with more advanced prostate cancer. So we wanted to sort of look to see how early in the disease could we give docetaxel-based therapy and determine if there was going to be an overall survival advantage by suggesting that earlier may be better. So we conducted a large phase 3 study across the cooperative group system in the United States, looking at, again, when men present with metastatic prostate cancer, hormone naive, adding in hormones, and half the patients received docetaxel for 6 cycles, which was a reduction from more advanced disease where the most recommended cycles was 10 cycles. So we tried to reduce the amount of docetaxel-based therapy and looked at an overall survival endpoint.
And how many patients were involved in the study?
So this was a 790 patient study. We had one sort of adjustment in the middle of the study to add more to make sure that we had enough power to get to our endpoint.
What was the follow-up period and what were the results at that time?
So this study has a cooperative group number of 2005, ECOG 3805. It launched in 2006. It completed accrual by December of 2012. The median follow-up that we present in the data is 29 months. So you can see that a number of the patients went on in the latter portion of the study, allowing us to sort of have that adequate time frame to evaluate our response of overall survival.
What was the magnitude of the effect expected?
So we were looking for a 33% improvement in overall survival for those patients receiving the combination of docetaxel and hormonal therapy versus those on hormonal therapy. The study was really focused initially on men with high volume disease, and we defined high volume disease as visceral metastasis or more than 4 bone metastases. So we were looking at that group initially, expanded it and let lower volume men participate. In the end, it was 70% of the patients had high volume disease and only 30% had low volume disease. And that really what's allowed us to sort of see this early endpoint of overall survival.
How do these results affect clinical practice?
So the results really do show a marked improvement in survival. So as the group as a whole, it was about 13 months improvement in survival, which was astonishing to each of us. And for the patients with high volume disease, the men at the most risk of progression, there was a 17-month median survival. And so that itself really stops everybody thinking about, wow, chemotherapy really does have a role in prostate cancer. This is sort of in the midst of chemotherapy for prostate cancer having been shifted later and later in the disease because of all the newer therapies that have now come onto the market, such as abiraterone, enzalutamide, radium. So the whole field has changed at this point. And so then we have this data. So it really asks the question, where does chemotherapy fit in? And I think in the U.S. we're going to have to really sort that out because we worry about side effects, and yet men tolerated this therapy. There was an early impact by giving it at that point. And so we'll have to sort of weigh out whether or not we want to still defer or give it earlier. I think in the developing world, I think being docetaxel being very cheap or off patent now, so it's likely to have a greater uptake. And for men who are at the highest risks at the time they're being told they have metastatic disease, I think this really does make a real change in how we're going to manage patients. And I also think it's a building block so that maybe earlier therapy can improve survival even further and hopefully cure people.
How important is the availability of funding for research into this kind of field?
Right, so this study started in a time where there was more research funding. Now as we go forward and we'll look at opportunities to sort of expand on this data or ask other important questions that may not be done by industrial sponsors about their new agent and trying to put into context the drugs that we have available, I think that really is where we're limited. The research funding is not there for that type of study, which is practice changing and sort of helping the person who's right there in front of his or her patient. What do I do? Ask this question with all that I have. What order, which sequence? So I think that type of funding has really dried up, and we really are concerned about trying to prioritize the right questions. So with limited research dollars, we can still make an impact. It's just gotten harder.